And away we go. So, Cathy, could I ask you to introduce yourself, please?
So I'm Cathy Henwood, and I work for an organisation called Well Springs Together, which is a charity that it's a joint venture between the diocese of the Anglican Diocese of Leeds and its independent charity. So we sort of cover the whole of West Yorkshire and a bit of North Yorkshire up to Skipton, and a tiny little bit of South Yorkshire. But we've got very strong roots in Bradford because we started as a Bradford charity more than 10 years ago and went sort of diocese-wide about 2 years ago. And we work in lots of different areas, social inclusion and loneliness. We've got places of welcome that have been we had about 20 across Bradford, for example, though some of those have obviously closed down or gone online or on telephone because of COVID. Our Near Neighbours project programme that a lot of you may be aware of, which works around integration and interfaith work. We do some work around homelessness. We work with churches to support them when they want to be more active in the communities. And my big piece of work is around food insecurity, which is largely sort of feeding Bradford and Keighley, but we are also trying to widen that out across the whole diocese as well. Feeding Bradford and Keighley, it's our food poverty network, and our vision is one where Bradford district where no one has to go to bed hungry and everybody has access to affordable good food, which of course is a really big vision, but that's what we believe Bradford should be. We work with food banks, we work with meal providers, low cost and pay as you feel, food markets and cafes, holiday provision. We also try and ensure that decision makers in the council and also nationally understand the situation on the ground and understand the sort of root causes of poverty. But we have very much a belief in sort of beyond the crisis, that feeding people is really necessary and saves lives, but we need to help people move beyond that. We need to help people get the help they need to get on with their life, whether that's confidence building, whether that's advice, whether that's lobbying the government around matters around benefits levels or whatever, which enable people to have a decent life, live a decent life and have enough money for food and other issues. We've got a real big push to widen our reach. We were aware that when COVID struck, obviously we worked with the established food banks, and that was really useful, but we're aware that didn't meet all our communities. And we've been working with places like the Kismet Centre and other places to make sure that the food banks that are giving out food that's culturally appropriate. And we've worked with the Race Equality Network to reach out to include a lot more organisations like Women's Zone into the food bank network, which I think is really useful and really important. We've recently launched a website back in the bit before Christmas, which enables more people to find out about where their local food banks are, where the crisis meals are, and where low cost food is, because low cost we feel is a real way forward for a lot of people. The dignity of being able to go and choose food that they want, pay a little bit towards it, which enables the food provider to be more sustainable, that they can keep going without needing loads of extra money, and gives people a sense of self-worth. So where people can not need free food, we think that's a really good way forward, and we're pushing the council to put more funding into building more of that provision as well. What else really? I think the main things, the takeaways that I want people to know is that feeding Bradford and Keighley is there for the whole of the community, and we really want wider engagement. We know that maybe we started as just with the people we knew, which maybe was more of the established organisations, a lot of them church-led, but not exclusively. We work with Save the Mothers Trust, we work with the Curry Project and the Curry Circle, and we've worked with them for a number of years. But we do know that maybe our reach initially was more on the established network, and we want to widen that out. But we also really want to encourage everybody to feel like it's not just about giving out food, that we need to look wider than that we need to look at the root causes, we need to build people's confidence, we need to build people's skills, and that it's, if you're just giving food out, and it is really necessary, but it's just putting a sticking plaster on, and we need to support all groups to look at root causes with people. So that's something we're very, very keen on. So we want to get that message out, and we're here to support any organisation who wants to think about how their provision could help people move on, whether that's into other provision or signposting, or whether they can sort of know about local organisations that can help them. So that's really the ask, is that people get involved with us. People ask us if they want help in widening their reach, or if they want help about how to move people on. And we're very keen, and I say the low cost side of things. I see Julie's just joined the call, and they've started a social supermarket, which is really great. That's where people can, pay £6 and get a bag full of food, but also get the help to move on from their crisis and move on to situation. So that's about it, really. I just wanted to give you a quick sort of lowdown, and we're really keen for people to engage with us if you know organisations that aren't part of our network, to engage, and so we can all work together for what I believe everybody sort of is about, which is sort of making sure that nobody has to go to bed hungry. I mean, COVID obviously brought huge challenges, and I think this issue around the vaccinations and things, it's not an area that I've been directly involved in, except to get the food providers on the list, to get us frontline workers to get early vaccines. But my colleague Kenise, with Near Neighbours, she's been a lot involved in bringing the test and trace stuff more into the communities, and also working about the issues around the vaccine and vaccine acceptance and things. But it's not my big area of expertise.
Fantastic. Thank you so much, Cathy. And yeah, I mean, Wellsprings are doing some amazing work across the district and supporting many food banks and other organisations. So Cathy, if you want to maybe drop into the chat any links to the website where food banks and other organisations can register. I'm going to move over to Professor Dinesh Saralayah now. So Dinesh has been doing some extensive work across the city to do with COVID and vaccines, and I sit on a working group with Dinesh that's been looking at the vaccine trials in Bradford. I'm just going to ask, as each speaker comes on, just to introduce yourself, and then stick to the 5-minute schedule for yourself. So Dinesh, over to yourself, sir.
Thank you, Shadim. So I'm Dinesh Saralayah. I'm a consultant respiratory physician, but I'm also the director for the NIHR National Patient Recruitment Center, which is the research wing of the NHS. We've established a patient recruitment center in Bradford to meet with the needs of the population to take part in clinical trials. As part of this endeavor, we were successful in getting the largest phase 3 COVID-19 vaccine trial to be brought to Bradford. So the Novavax phase 3 COVID vaccine trial is imminently in data lock for an interim analysis. But probably we are hopeful that it will be in the same place as the other 2 licensed vaccines, which are being rolled out in the next few weeks. And I firmly believe that Bradford would have played a very important role in taking part in this vital vaccine trial work. So as part of that, Shadim mentioned he was part of our group. We had quite extensive engagement with our community here in Bradford to represent the population that we serve. And we ended up with a 8% recruitment rate from the BME community of the total of 726 participants who took part in the trial. So the trial looked at evaluating the efficacy of a biotechnologically engineered vaccine against the spike protein of the coronavirus. We know that all vaccines are of different technologies, whereas this was a halal kosher vaccine, vegetarian, which had no animal components or porcine components in it. And I believe the UK government has already purchased 60 million doses of this vaccine with the faith that they put the vaccine task force and the JCVI. I believe that this will be the vaccine. Once it gets a license, will be rolled out across the city. So we are keeping our fingers crossed on the interim analysis, and hopefully we'll be able to feed back to the city on how successful we are with that. So we've just cleansing all our data at the moment. People have finished their 3-month visits where their antibody response is being measured. And like other vaccine trials, there will be an interim analysis. So I must remind people in this group that the Pfizer and the Oxford vaccines have not completed their entire run through. They've done an interim analysis at 4 to 6 months. And using that interim analysis, have managed to get regulatory approval to be rolled out in the community. And while there are certain active participants still in the trial as open label, because what will happen in those trials is we'll unblind the people. And we've also done a lot of work around the vaccine hesitancy in Bradford, around the myths surrounding the vaccine. Shadim has coordinated a group which is quite active in dispelling the myths. And I've not been so much involved in the NHS COVID vaccine rollout, but I know that one of the vaccine hubs in the Bradford city is at the Bradford Teaching Hospitals. And then the hospital has aspired to vaccinate every BAME staff member by the 22nd of January. And I think they have achieved that. And they hope to be vaccinating the entire hospital staff by the 25th, which was Monday, which was gone. I've not had the up-to-date figures on that, but an ambitious target that we would be vaccinating in keeping with the national goal to vaccinate our vulnerable, the top 4 sectors of our community by mid-February. And I think we are well on track to that. You must have read in the national news, over 6.3 million people have been vaccinated as of yesterday evening. And I think that will go, it's exponentially rising as we widen it out. I must point out that the NHS vaccine is only 1 doses at the moment. So they are either being, the Pfizer has only a small procurement to this country, whereas Oxford will be the larger vaccine because of ease of administration and how it's rolled out. And we think that the third vaccine, which will play a very important role, fingers crossed, would be Novavax. And we're very hopeful that we will be pretty imminently in the news about the success of this vaccine.
Thank you so much, Dinesh. For anyone who does have any questions for Dinesh or any of the panel members, please feel free to put them in the chat. And we will be having a bit more of a discussion about the vaccines and hesitancy a little bit later. We have had an apology from Victoria Simmons. Her daughter's not well, so she's had to jump off the work list today. But Victoria has said that one of her colleagues has joined the call and would be able to answer any questions relevant to the current vaccine rollout. I'm going to ask Sofia Mahmood to unmute yourself. So Sofia is the founder of Empowering Minds and the current director. Sofia, if you're able to unmute yourself and...
I was just going to try screen share if that's possible.
Yeah, please do. Let me know if you've got the rights to do that.
No, not at the moment.
Yeah, I'm going to make you...
Okay, I'll introduce myself whilst you do that. So my name's Sofia. I'm the director for Empowering Minds Consultancy, and I've been working within communities for approximately about 19 years now on controversial subject areas. And my role today, realistically, is what I wanted to speak to you about. Yes, Shadim, thank you. Is about the areas around misinformation and disinformation and what we are receiving from communities and what communities are stating in terms of their reservations and concerns. So I'm just going to share a small PowerPoint with you because I know I've got 5 minutes to do this. Just give me 1 second. So I want to talk to you today about the community engagement approach on this. And I know that there's some amazing speakers on this panel who are doing an amazing job in trying to get this work out there and trying to engage with the communities to get the vaccines out and make sure that we are vaccinating as many people as possible, because our job is to safeguard everyone, and that is the reality. However, there are some real concerns. So I just want to talk to you about some real issues that we are finding within communities, and that is people are confused. There's so much mixed messaging going on in terms of what people are receiving on social platforms, what people are receiving via WhatsApp, what people are receiving by the government, and what people are receiving by the communities. Some of what I'm going to share with you today is probably nothing new. I'm just going to put it into a clear context for you in all the communities that we've consulted and what they are stating. The real issues are there's a lot of sharing information, which is disinformation, misinformation, and it is going very viral. To give you for examples of some information that has been brought to our light, has been a voice recording that had gone around to communities stating that the Bradford Council were going to be closing all their offices, and someone had been in a private meeting with some senior people, and basically the council are not telling you all the information that you need to know. Now, I received that through our community ambassadors, and the voice on that voice note had come across very professional, very clear cut, very, very smart in how it was done. First and foremost, it was confusing that people were not sure if the offices were open. Were the army going to be drawn in? Why would the army? There was pictures viral going around about the army being drawn in and that people are not telling you the information. And then obviously you've got the trust in the public health authorities that people are feeling about, and you know, Professor Dinesh touched upon this about the vaccinations and, you know, in terms of the ingredients and so on. That is a big concern with communities and people. And this is not specifically the BAME community, and I need to make that very, very clear that these hesitations are not just coming from the Black Asian minority ethnic group, specifically the Pakistani kind of group. These are coming concerns from a range of communities. Now, the reason why the trust in the public health authorities is because people have stopped putting on their TVs. I did an interview the other day for the Yorkshire Post, and some of our community champions have said, we've stopped putting the TV on now because we just have no trust. We have real concerns on the fact that there is fake news. The lack of accuracy in information is what's confusing people. And there's obviously now a lot of memes, a lot of jokes that are going out there. We've produced this leaflet, and it's a really clear-cut leaflet. This is just something that, but we have got hard copies of this leaflet, which we can get out to organisations, and we have had a number of organisations contact us for this. And it's clear, how does fake news spread? People have a motive. There's a full political agenda fed into this. I work on Prevent. I look at the whole narrative and how that is, and how things are created in community tensions. And the disinformation is some people have a clear message in how they want to get the information out, and what they will do is they'll share posts and articles which are in relation to those, being rumours and so on. There's a lot of fake news going around, which is creating mistrust and which is creating tensions within communities, and communities are now thinking, who are the trusted sources? And we have got many trusted sources within the communities, but the concerns are on a larger scale, not just at the community level. It's a virus, it's going around really quick. We're living in a digital world. Everyone's today on Zoom. We're not face to face. You can hit a larger audience. Fake news facts is 70% is more likely to be shared. And that's because it's designed to make people feel angry and outraged. There's a lot of hidden agendas around certain things, but then people having the critical thinking skills to be able to dissect. And the clear cut is it authentic? Do your research, stop it and don't share it if you feel that it's not true. However, people will be quick to forward because of the issues that I've raised in the first PowerPoint, and they will be quick to forward that because there is that lack of trust. What can we do?
Sofia, 1 minute, please.
Okay, so what can we do is really clear cut, is ask questions, but these are my solutions. We need clear cut accuracy in the information that we're going out, the trusted source and the channel in which it's coming out to, what roles people play and how do you receive that information. The approach to allow people to ask and provide clear answers, not strategic answers. These are clear cut answers. Language is relatable, understand the impact. And I know Shadim's touched on this, where I've got this from, which is the recovery phase, and answer the questions that the community are asking. That's literally clear cut. I'm gonna leave it as questions towards the end, as Shadim has said, but if you need to contact us, get access to our leaflet, ask us further information, please do so. Okay.
Wonderful. Thank you so much. And thank you for all the amazing work you're doing, Sofia. We're going to ask Reverend Nathan. Nathan, do let me know if you can unmute yourself. I think you're on as a co-host.
How am I?
Hi, welcome. Reverend Nathan, can you just introduce yourself and then share with us some of the work that yourself and your colleagues are doing at VIP?
Yes, let me just introduce myself first. Reverend Nathan from the Grace Baptist Church in Haworth. And I think Dinesh was speaking earlier on, and I was mentioned by our nurse, one of our nurses in the church, that she is working with Dinesh, called Rachel. So regards from Rachel, Dinesh, and a few others. But this is my work mainly among the communities itself. And I do get a lot of different activities that I have, different places. But VIP is something that I've just been putting myself forward for the last year or so. Javed, Bashir, and a few others that have come forward in putting this group together since the month of March last year, when the COVID crisis hit really badly. And now we're seeing that it's really worsened to where they were before. But all this time, people have been helping, talking to people in the community itself, and food parcels that were distributed via the VIP group itself. Amazing work that has been done in Bradford itself, and it really has taken off how people have come up to us and talked and told us all that is going on, and especially about the vaccine. When will that be really rolling out and so on? Now is the time that we see that is happening, is come forward, and we are so grateful for that. But on the other hand, I think there have been some myths that have been happening within the community itself. And we've been making some certain videos, which I'm sure Shalim will be able to show you in this place here. And it'll really highlight certain myths that community has. And my sister has already touched on many things which I had in mind as well. So I don't want to repeat those things. But media has an issue that we come forward that needs to bring really right reporting. It's not only one reporting that needs to be done, but all across the board. And when the mixture of messages come through, people do get confused. And confusion is one of the things that I've faced myself personally when talking to people on the streets or, giving out food parcels over the VIP course of this time. It's amazing how people have really confused themselves in this way. But please do show, Shalim, the video that we have produced.
Should I share that now, Nathan?
If you can, please. Yeah, thank you.
Nathan, could you also just explain what VIP is, please?
VIP is the Volunteers Interfaith Partnership, which really took off in March, the month of March. And we are a group of local, I am from a Christian community myself, helping the other faith forums that are helping the community understand the value of what we are doing and so on, also helping in different ways. So that's what it stands for, the VIP Volunteers Interfaith Partnership. So we have a person from a Hindu background, a Sikh background, a Muslim background, and then myself. So all are helping together in this crisis, and many others that are involved and becoming part of this program. So please do watch the video. It'll be a help to understand a bit more what we have been doing over the course of the year. Thank you.
Thank you so much. Nathan, can you just confirm if the sound's okay when I play?
Yes. Yes, brilliant.
The government is rolling out their vaccination campaign and claims that tens of millions of people will be immunised by the spring at over 2,700 vaccination sites across the UK. False news is likely to be causing some people to reject the COVID vaccine, claiming that jabs contain alcohol or meat and can alter patients' DNA.
It's clear that ethnic minority groups are being hit harder by the COVID-19 pandemic than others. 57% of Black and minority ethnic people said they would take the vaccine, compared with 79% of white people.
Bringing COVID-19 to an end will require active participation from faith communities.
We also published full information about the myth, misinformation, which is being in the social media.
A recent statement by the British Islamic Medical Association has confirmed that there are no animal products in the vaccine and it does not contain any human embryonic cells. Therefore, we will urge Muslims eligible for the jab to take up the offer.
As a Hindu and an active Rotarian, I'm in favor of taking this vaccination. In fact, I've already taken my first dose and feel completely well with it.
As a Baptist Christian denomination, we do not have theological objections to vaccination. My priority right now is to help dispel myths and misinformation about vaccination and treatments for COVID-19.
Because the coronavirus is a very, very dangerous thing. I will request all the members of the community, they should have that vaccination.
It's much safer for your immune system to learn how to protect itself through vaccination than by catching the virus.
I've taken the vaccine myself and I would urge you to take it also.
बचने का चांस है। भले 100 में से 10% भी बचने का चांस है तो आपको वैक्सीन लेना चाहिए।
Fantastic. Thank you so much.
So let me just wrap up. So these are the people that we see are helping. Hello, can you hear me still? Hello.
We can hear you.
You can hear me.
Can hear you fine. Can hear you fine.
Brilliant. So this is what has happened over the course of the year, that we produced different meetings, and at some point we've been to the University of Bradford, we've been to other places where we've fed people, but on the other hand, we've made an impact on people just thinking positively for VIP growth. So that's what VIP stands for. I wouldn't be taking much of my time and your time. Thank you. Shalim, that's all. I think the video was very clear. Are you there, Shalim? Unless you want me to continue speaking.
Thank you so much, Nathan.
Allah responds to her and says that
could we get Dr. Rafaqat to come on now, please?
Yes, I'm already on.
Yeah, great. Dr. Rafaqat, could you just introduce yourself and then share the work that you've been doing?
Okay, so I'm Rafaqat Rashid. I'm a GP at Picton Medical Centre in Bradford. Now, my other role is as a Muslim scholar or an imam, probably more so recognized internationally rather than I am just more locally. But I do a lot of work around education, providing lots of courses for the Muslim community, generally different sort of industries within the Muslim context, as well as sort of professionals, so mainly doctors and the medical sort of field, as well as imams, etc. Now, I'm a co-founder of Balagh Academy, which is an international organization. Shalim, am I able to share? I'm not sure if I can share, but I'll see if I can. I might struggle a bit, but let's leave it. Maybe it's probably not a good idea. Okay, so
you are as a co-host, Dr. Rafaqat, so you're welcome to share your screen if you wish.
Okay, I think I need to put a URL. I'm on my phone, so it's a bit different to using a laptop. But anyway, so the Balagh Academy organization, over the last, since March, earlier than March, actually February 2020, we've been developing a number of courses which deal with a number of essential areas around coronavirus and the pandemic. Now, as part of that, we've had international speakers. So we hit an audience of approximately 10,000, probably 20,000 people. And this audience is not solely UK, though majority are UK, but a lot of them are international. So some of the courses, on there we have Muslim scholars, we have scientists, we have people from the medical field, we have people from sort of the psychological sort of end of things, as counselors and various other things. So some of the topics that we've actually covered are topics like, for example, home isolation, Islamic tradition on trials, tribulations, and resolution, rulings related to pandemics, outbreaks, risks, and impact and mitigation. A lot of topics to deal with issues that are relevant for not only the Muslim community, but also imams in particular. So we've even developed Islamic fiqh guidelines or toolkits to manage epidemics, and we've done an immense amount of work. So we've had an excellent response from that. So that's more sort of in some of the international stuff that we've done, but more so locally in terms of nationally. We have, or in particular I have, been doing a number of different webinars dealing with different sort of communities. In Bradford, the uptake's actually not too bad from my understanding amongst sort of, in particular, Muslim communities. But we have some serious problems in various other parts of the country, such as just recently in Walsall, I've been informed there that there's about 40% uptake, in particular with the Muslim community there. So we've been doing a lot of sort of webinars, mainly focusing on misinformation and sort of stating the facts regarding vaccines, looking at it from an Islamic perspective, especially dealing with things like, for example, ingredients in vaccines and things around there. So we've had an excellent response. We've sort of been working around different sort of areas, but our focus has been more academic in terms of providing a lot of work in terms of framework. So if you look at, for example, Bradford Islamic Medical Association, we've been working very closely with the British Islamic Medical Association in providing some of those guidelines that you've probably all seen, as well as with BBSI, which is the British Board of Imams and Scholars. I've been working very closely with them, providing number one, a lot of guidelines for mosques, etc., and also guidelines for Muslim scholars, as well as some preparation of articles for journals as well. So clearly, a number of different sort of areas of work. What I will do is I'll put a link on for those people who are interested in some of the things that we've done, in particular some of the webinars that we have. Hopefully you sort of benefit from them. I won't take too much time, so I'll quite
thank you so much, Dr. Rafaqat, and it's I think you hit the nail on the head, really. Bradford has become somewhat of a leader in terms of the work that's gone on across the district in many ways through COVID, and most especially all the excellent work that's going on at a community level is having a very positive impact. So what we're going to do is we're going to move to the discussion part of the session, and I'm going to ask Sue. Sue, I've made you one of the co-hosts. There is some background noise, so I'm just going to mute everyone and then just unmute the panel speakers. Okay. So Sue, if you're able to unmute yourself.
Yeah, I'm unmuted.
Oh, fantastic. So could you just introduce yourself and just share some of your concerns around how things are currently being managed in terms of the vaccine distribution, etc.?
Yeah, so we've been working, so I'm Professor Sue Pavitt from the University of Leeds, and I've been leading a project with Shamila Anwar called COVID and Me Vaccines. And we've been looking very much about inclusivity and making sure that we can reach the underserved communities that are particularly affected by COVID-19. And it is really challenging to get these messages out to the very communities that we most are the most vulnerable, really. And I think that the video that Nathan just shared with us was fantastic. I mean, what we're seeing a lot of on the news at the moment are very fear-mongering. Every night we walk through the ICU with Hugh Pym, and it's, no doubt it's a very serious situation. But what we wanted to do is, we know that a lot of the communities are quite turned off by the BBC News and the fear and gloom, and they won't go near it. And it's how we reach the poorer communities, which transcends ethnicity and religious beliefs. And we've been trying very hard to use digital theatre to do this, using multiple languages and some famous actors and actresses to help us spread the word. And I'll put it in the chat so people can see what we're about. But it would be really fantastic if we could start to get these out into the community. And what we did a lot of research with the community to understand what their beliefs and concerns were, one of which is they don't like the word myths because it is their belief. And so I think that's one of the things I would urge this audience to take on board, that that these are their beliefs that they have, and we must be respectful of that. But we've done a lot of work with the Asian community, and Shamila in particular has been invaluable with her Pakistani Muslim background, but also with the Black community, and understanding the Nigerians and their hesitancy for vaccines is basically what happened historically back in Africa, in Nigeria, with Pfizer. So you can understand their particular reluctance over that first vaccine coming through, where people, children's lives were lost, and there's a great vulnerability around that. And we have to be respectful that all these communities have their own reservations, and like you say, there's lots of misinformation circulating. what we've tried to do in these monologues, which is taking a single character and actor to relay information that's been gathered from the personal stories that they've listened to and heard to, is very much dealing with misinformation, dealing with the cultural context, but doing it with humour and doing it in a real life situation. And Ruby's been absolutely pivotal to us in actually helping us gather that information and help work along the script writers to do this. And we just think this could be a very refreshing way to get out to communities the same messages, but with a different, maybe with health literacy and the accessibility is different using theatre. And we're all desperate for seeing new programmes on the TV, and this would provide that. They also work as podcasts, and the local radio has been helping us get them out there as well. So, but I was just thinking when I heard Cathy talk about the Wellspring, it would be fantastic if we could put some multi-language leaflets in about the COVID and Me work that we've been doing so that it can reach people. And I think that's what we need to do is bring all the fantastic, all of you are gathered because you want to make a difference. And that's just a fantastic audience really to start to see how can we cross-pollinate to work across these boundaries that we normally have.
Thank you for that. Dr. Sue, can I bring in Shamila now? Shamila, we just crossed paths in recent days when you wrote that excellent opinion piece that was shared. Shamila, are you okay to unmute yourself and just share your thoughts, because I guess you've got that professional background and in the work that you do, but you're from one of the ethnic minority communities we're talking about. Are you okay to talk now, Shamila?
Yep, I can do. Yes. Can you all hear me?
Yes.
Brilliant. So yes, I mean, I got involved in the initiative with Sue. Me and Sue kind of go back quite a few years. We've worked together a long time, and so my experiences of the kind of general thoughts about the vaccination, about the COVID-19 pandemic, when it first started back in March, was that everybody was just so concerned about what this would mean for them. I mean, not only were we dealing with kind of very fabric of our community completely being lost because we weren't allowed to sort of see each other. We've always been taught as Muslims to have our doors open for visitors, and then not having that, and then on top of that having to then process this information. And I think that everybody knows that research happens, but the way that the pandemic has sort of literally thrust the research world into the limelight, and there's been no kind of real engagement with communities up until the pandemic started in terms of, understanding what their needs were and how best to serve them. I think that just kind of made the situation worse. When we got together and started discussing COVID and Me, it was very much to help engage and understand the communities we wanted to serve. Help obviously increase education and understanding about vaccine research, COVID-19 research, and then also the vaccination programs. And a product of that has been the development of these monologues or digital theatre films. And I think one of the key things for me is actually having brought the communities together alongside the consultants, the medical, the vaccine experts and everybody, so that everybody can hear what the concerns are. And as Sue has said, it's very much about their beliefs. These concerns that these communities have are very much rooted in something, whether that is some historical experience of a badly run clinical trial like in the Nigerian community, or whether that's something to do with your faith and reconciling having a vaccine with your faith. These are rooted in something. They're not myths, they're not kind of made up things. And that was one of the key learning points for us. It was very much that language is very, very important. It's very important to understand that the communities and their concerns aren't to be kind of brushed aside, and we have to unpick where all this information and where all these views are coming from.
Thanks for that, Shamila. And I would really recommend everyone to have a look at the videos that have been put together. They're very natural people who are sharing their experiences, and I thought they were excellent. I'm just going to ask Shabnam Mahmood, who's a BBC reporter, Shabnam, are you on the line? Are you okay to unmute yourself and put forward some of your questions that you had for the panel?
Yeah, sure. Thanks, Shadim, for giving me the opportunity to join this session. Some wonderful things have come out and I'm really listening with interest. But basically, I've been tasked to look at vaccine hesitancy amongst the BAME community. And there's been a lot in the media to say that there is a vaccine hesitancy among BAME communities. But what is that actually based on? The figures the surveys that some of the surveys I've seen are quite small, they're unofficial surveys. And also, we're talking about the Asian communities over the age of 70, which are actually those that have been vaccinated, which are actually sort of like make up about 1 to 2% of the population, if you see what I mean. So how many Asians that are South Asians that are reluctant are we talking about? And also, should we not be talking about the take-up of vaccines? I think somebody mentioned on the panel that Bradford has had a good take-up, but what is the take-up amongst ethnic minorities? So, for example, if a doctor sends out 100 letters for jabs, how many are actually taking the jab? Is there a way to find that figure out, the take-up? Can anybody help?
Thank you.
Nadim, can I answer some of the take-up questions?
Please
yes,
do.
please.
Yeah.
So first of all, with regards to the trials, so our take-up for the vaccine trial was, as I mentioned, about 7%. So out of the 726 participants that we had just over 50 participants belonging to the South Asian community and the BAME community, predominantly South Asian, 48 of those.
That representative of the community in Bradford then?
They were not in the trials, but I'm just coming to the NHS rollout. So I've then been in touch with the City Confederation who have been rolling out the vaccine in the city. And I asked them in the 80-plus-year-olds what was their keep their appointment rates. We call it the DNA rate. And the DNA rate has been small, partly because of logistic issues of some of them coming to the vaccine center. So the DNA rate has been between 20 and 30%. So up to 70% of people have been coming for their vaccine appointments in the 80-plus-year-olds, which is very, very encouraging. I'm a firm believer that the vaccine eventually will have to go out to some of the people. That's why a vaccine with a very easy cold storage and an easy administration protocol will be the way that we will then get the entire population vaccinated. Because there's so much of publicity about two things. One, why are these vaccines being approved so quickly? And I'm happy to touch about that. Normally, vaccines go through various phases of the trials. And the delays in why a vaccine takes between 6 to 7 years to develop is because of the regulatory approvals and the protocol submissions that have to happen. What has happened with the vaccine trials is that has been expedited and protocols being developed and subsequently gone through the various phases have happened concurrently. So what would normally take a rather delayed period of time has been done more efficiently, should we say. With regards to the technology of the viruses, now, you know that COVID-19 belongs to the SARS-CoV family, and it is a coronavirus, and we've had SARS-CoV before in the early 2000s. Now, the world community might have missed a chance to develop a vaccine because it was never pursued against SARS initially beyond phase 1. You may call it maybe a miscalculation on our part that we never thought we will have another SARS pandemic. Development of a vaccine for the Middle Eastern respiratory syncytial virus still ongoing. But then the way that we have developed the vaccines for COVID have been second to none in the accelerated way it's developed. Now, I must also point out that the vaccines which are rolled out in the NHS have regulatory approvals and are also still going through some of the rigorous testing that they would do as part of any phase 3 trial. So these vaccines, it's important to get that message that the vaccines are being closely monitored. And the common target for these vaccines is the spike protein, because that's the most amenable form of where you can influence the virus from binding onto the cell of the body and taking over what we call taking over the cell of our body. So the technology is fairly simple, it's well known, and it's important to try, as Sue and Shamila have already pointed out, is to get that language in simple language to say that this vaccine has gone through the rigorous procedures of development and how it should be taken up within the population.
Thanks for that, Dinesh. I'm just going to bring Sofia in. Sofia, I'm conscious you've got to leave the call. So just in terms of the discussion that we had when you first joined this panel today, and hearing what you've heard from Shabnam, the other speakers, what are your kind of main concerns about the way things are being managed at the moment, and the fact that maybe there's quite a lot of focus within sort of BAME or minority communities, whereas in fact this is a much more widespread issue as well?
Yeah, thank you, Shadim. I think it's been really, really interesting hearing so many points from everyone, especially the thing that Sue and Shamila had touched upon, the word myths, when it is in regards to someone's beliefs. And I think that is really, really crucial, that you are dictating. And I feel like at the moment we're dictating to communities, and we need to be listening to communities. And I understand everyone is working towards a common cause. But like Shabnam said, we need to look at the surveys and the stats. Where are those surveys and stats? And I understand, Dinesh, what you're saying in terms of there's a reason why the vaccine's been rolled out so quick. It's because we're in a world pandemic, and that's why they have to get this out to make sure we save as many lives as possible. I think to be honest with you, Shadim, it's such a depth conversation. This, and I have so many points to raise on this. And one thing is that, it's really good seeing the VIP video and hearing everyone's champion the cause that we all need to work together. And I've had my grandma hospitalized with COVID. I've had my mother have COVID. And it was very, very scary times. And even when we were sending my grandma to the hospital, it was the whole thing of, they're going to kill her off because she's 80 plus and they're not going to, she's perfectly fine. She's home. She's fighting fit and strong. There's nothing wrong with her. But what you've got to realize is that there's agendas on some people's radar, and some people are trying to cause those tensions deliberately because they want to reclaim a narrative that they have got. But just one last point I'm going to say, Shadim, is Matt's team, at Bradford for Everyone are doing a really good campaign, and it is make sure it adds up. And that is the whole thing. All the information that you're receiving, make sure that it adds up, make sure that it's clear. But like Shamila and Sue said, is that have those honest conversations, stop dictating to people, have those pointers where you can sit and you can talk. And even with our workshops, we sit and we have conversations with active women in the community. Now, realistically, I'll be honest with you, that I could go into so much in terms of how Twitter's rejecting certain words that have pandemic in it. There's so many things that the government are obviously wanting to roll out and get vaccine. One of my questions is Professor Dinesh had talked about the BAME staff being vaccinated and then the rest of the staff will be vaccinated. I don't know whether I'd heard that wrong, but for me, why is it that the BAME staff are being vaccinated first? And then there's other things that I've seen where articles in The Guardian have stated that this is because there's extended families living with amongst extended families in the South Asian community. You find that in the Gypsy community, you find that in the Roma community, you find that in a lot of communities. And I think what we need to look at is there are questions. Let's just answer the questions clear cut. Like, Dr. Dinesh had said earlier on, is just be clear. This is the reasons why the vaccine has gone through these many channels, and this is why we've got it out. But stop dictating to communities and respect their values and their beliefs, and don't put the blame on one specific. And there's so much research that I could start sharing with you guys, and I'd be more than happy. And I know Shabnam knows my views on these kind of things. I've worked with her in the past, but I just think let's get clear stats out there, and we're all here to safeguard everyone. I don't want to see more than 100,000 deaths. That was shocking. People are frightened to put the TV on because it is so ingrained in their brains in what they are seeing. And on 10 o'clock at night, I don't want to be seeing the news going through hospital wards. And it is frightening because I've had 2 horrific cases in my own household where we've had to look at this. But I'm going to leave it as that.
Thank you. Shamila?
Yeah.
Put your hand up.
Yep. I think if we start from the premise that we need to learn how to serve our communities as healthcare professionals, whether it's in research or whether it's within the NHS, it's about learning how to serve our communities better. I think that starting from that premise, is where we need to go from now, rather than telling our communities what to do, because we may not be telling them in a way that is engaging and resonating with them and helping them to understand. So I think that's all I wanted to say, really. It's about learning how to serve the communities that are around us that we do need to serve.
Okay, there's a question.
Just one point on Shamaila's. I think that is such a crucial word, serve our communities. We are working to protect our communities, so crucial point, definitely.
Thank you, Sophie and Shmaila. Question here from Zaf Shah for Dinesh and Sue. Dinesh, I'm conscious you need to jump off and we will try to wrap this up. So please provide clarification on the differences between emergency use authorization and the usual regulatory approval process.
So can I tackle that? So I've already highlighted that very briefly. See, normally in any vaccine development, it goes through 3 phases. So you have a phase 1 trial looking at healthy volunteers. Then you have a phase 2 trial looking at a small subset of the population. And then you widen it out to a phase 3. Now you have to develop a protocol for phase 1, interpret the results, and then you go to a phase 2 application, and then you do phase 3. With these vaccines, because of the urgency of the position, they were concurrent. So for example, with Novavax trial, they did the phase 1 initially before July. And at July, they commenced regulatory approvals or ethical approvals to submit both phase 2 and phase 3 together. So while the phase 2 trial started in early August, the phase 3 trial started simultaneously, using some of the data from the early phase 2 trials into the phase 3 to see that there was a promise that it can be carried out in a wider population. So the phase 2 started in August, the phase 3 started end of September. So as we are getting the data from the phase 2, which is a smaller subset of population, we are able to then translate that into a more real life experience in the phase 3, so that the data, the safety data in phase 2, along with the efficacy data in phase 3, so there are various aspects to a trial. We have to make sure that the vaccine that you're developing is A, safe, and 2, it's efficient. And so you combine those 2 data in 2 separate protocols. And as you get promising results coming from phase 2 and the promising results coming from phase 3, you then say, we are going to do what is called as an interim analysis. So every trial has a primary endpoint. So in case of most vaccine trials, is the number of moderate to severe COVID infections that the trial population has. So of course, when you take part in a trial, you're blinded. So you can either have the true development vaccine or placebo. And if you have a certain number of active infections, you do what is called as an interim analysis threshold. So above the threshold of that certain number, you then take that population and unblind the number of positive people. If you've seen a large number of people develop active infection in the vaccine, then you need to look back into your data and say that the vaccine may be a failure, because you must remember, some of these vaccines will fail in phase 3. Fortunately, most of the vaccines, I think, this is my own personal opinion, that COVID-19 and the SARS-CoV virus is a vaccinable responsive virus. And so I think we will have lots of candidates, and we need a lot of candidates, as we have seen. Already there is what is called as a vaccine hierarchy going across the world, where we need vaccines which will roll out to the developing world and in Africa, which can be easily administered with a very, very less stringent cold chain. You can't logistically administer Pfizer in a country which has 40 degrees. So that's why.
Thank you so much. And I think, with some of the historic work that went on through COVID, Bradford set itself up much better than other places because of the relationships that have been developed. And obviously this forum that we're on today, myself and Matt Henderson had started this at the start of the first round of COVID. Matt, did you want to share something there?
Yeah, if that's okay, Shadam. I realise we're about to wrap up and it's 1 o'clock and probably people have timescales. I just want to say thank you to Bradford Foundation Trust, Shadam, and everyone for pulling this together, Race Equality Network, and everyone who's been on the call, listening to all the fantastic work. Bradford has been a leader in a lot of ways, which was mentioned. And there's a lot of really great innovative ways that we're getting information out to communities, BAME communities and all communities. And I just wanted to say we're working, Sofia mentioned this, so thanks very much for that, Sofia, our Make Sure It Adds Up campaign, which is aimed at promoting critical thinking as opposed to myth busting, because we find that myth busting involves profiling the rumours more, whereas what we feel is we can get information out there, great work showing examples of people taking the vaccine, people from the community talking about the vaccine, information in different languages, etc., and give people information and increase those critical thinking skills, because we realise that people do have different opinions and we don't take a right or wrong approach or target a community. We say this is about everyone. Our campaign is about tackling prejudice around migrants, Islamophobia, working class and LGBTQ+ community, but we're using it for COVID. And what we're trying to do is promote critical thinking and move away from myth busting. And without, myth busting, not a lot of resources put into myth busting other rumours. And if you think of some of the high profile conspiracy theories you might get on YouTube, no resources put into myth busting those rumours, because we can think critically about them. So we want to move towards that in terms of COVID, working with all the great people on this call, the professionals, sharing information, facts, in culturally sensitive, language sensitive ways to reach all communities and increase that critical thinking. So if you want to know more about that campaign, make sure it adds up. You can find out more info on our website, bradfordreverend.co.uk, or look at the hashtag, make sure it adds up. So I just wanted to add that and just thank everyone for the session today.
Thanks for that, Matt. I have just shared a link in the chat to a public folder. Let me just see if I can share this with you. So basically, this is a shared Google Drive, which we created on the back of the last call. In here, you'll see some of the stuff that Bradford Foundation Trust has been doing. You'll see useful information from across different sectors. So if there's any organizations that have further information, so we've got here something from BEMA and the excellent work that they've been doing. We've got here from the council and information they've been sharing, because it's almost got to the stage where it's information overload, and there's so many different people doing different parts of the work that we do need to take a bit more of a joint up approach so that it is a bit more efficient. Some of you have been asking about the work that the Race Equality Network are doing and the recent announcement in Telegraph and Argus. So on the next forum, which is on the 10th of February, so these forums are scheduled every 2 weeks. So on the 10th of February is going to be the next forum, and we're hoping to get Hummer and possibly Hattie from Ren to come on and share some of what is going on there. There is other partners involved in that project as well. If there is any of the audience that wish to share anything on the last panel, it's a completely open forum. What we try to do is focus on the topics and issues that are most important. And obviously, I think we've touched on that today. If there's any other points that anyone wants to make before we wrap up the session, then please feel free to do so. I think, Shamila, do you wanted to share a video, or Sue? Are you able to do that on your screen? Yeah.
Yeah. Yeah, Sue's asked me to share the trailer for the COVID and Me videos.
Yeah, go for it.
So let me just see.
Lada has better bandwidth than me, so.
Can everybody see my screen?
Yep.
Yeah, great.
Like our Mango Man, who posted on WhatsApp that everyone will be forcibly injected with vaccine and they will get corona. Tell him it's not a live vaccine, Mum, and no one will be forced to have it.
My boy said he would participate in a vaccine trial, but he also said, actually, Mum, it's people like you they need the most. People who wouldn't normally do a trial. People like me. He meant terrified middle-aged women with diabetes and a 20-a-day habit.
I took a selfie when I got my first dose of the vaccine, and Mum posted it on the WhatsApp group. There was a flurry of messages from the anti-vaxxers, and Mum replied, tie your camel up first and then trust in Allah.
But the most important thing really is, how will they know if the vaccine will work on people like us and be safe for people like us if they can't test it on people like us?
ਜਿਵੇਂ ਸਾਡਾ ਆਮ ਵੇਚਣ ਵਾਲਾ ਆਦਮੀ ਉਹਨੇ WhatsApp ਤੇ ਪੋਸਟ ਕੀਤਾ ਕਿ ਸਾਰਿਆਂ ਨੂੰ ਜ਼ਬਰਦਸਤੀ ਵੈਕਸੀਨ ਦੇਣਗੇ ਤੇ ਸਾਰਿਆਂ ਨੂੰ ਫਿਰ ਕਰੋਨਾ ਹੋ ਜਾਏਗਾ. Tell him it is not a live vaccine, Mum, and no one will be forced to have it.
They believed these WhatsApp messages that were being shared across their networks. I warned Fola, don't share them. They are full of lies, making people scared.
I'm going to let go and leap.
Like our mango man.
Thanks for that, Shmaila. And excellent work there. Really impressed by how you've brought together the different faiths and ethnicities. Dr. Rafaqat, I guess it'll be closing words from yourself. Please feel free to put your hand up, Dr. Rafaqat.
Yes. I just wanted to thank you and thank the speakers. It's a very illuminating and encouraging talk. I do take calls for the NHS, so it's very useful to listen to this. But I'm sure many more would want to listen to this discussion. Is there a link or something you can give so that I can share it with everybody, especially the last video and the presentations which went on earlier? Is that possible?
So, Peter, the session has been recorded, and we'll share the minutes hopefully by tomorrow, and a link to the video which circulate. But for all of the speakers and all of the resources that have been shared, we'll put them in the minutes so that if anybody wishes to pass them on or circulate them, you'll be welcome to.
Thank you very much. Thank you.
Welcome. Thank you. Dr. Rafaqat?
Yeah, I just really want to just finish off with a couple of things from what I'm picking up from the community. So I think we've got people here very actively involved in the community, but I think it's important to sort of sometimes reflect on what people are saying. And so I tend to engage quite a lot with those people who are hesitant about vaccines in particular, because I think it's worthwhile listening to them. And some of the reflections that you'll get is things like, for example, we're hearing that certain communities there's a low uptake of vaccines in those particular communities. That's evidence that this vaccine, so this is used as evidence that in essence that, there is an issue of safety and people don't trust the system. Now, I think sometimes we can overplay this a bit too much. And the things that they tend to reflect on is, look, the government's really paying on this. So you've got many people from the community are going out, producing videos to define the contrary view that they are safe. I think the biggest thing that you can possibly do to really get this element of safety message across is produce as much information as you can, or videos, social media videos, very simple ones, or people actually being vaccinated, people who are actually having it done. We're talking about misinformation, but reality is the thing that really works is when people are assured that there are members of my family who have been vaccinated. When they see that, then they can clearly identify that this is the actual, it is safe. So from my family members, my mother's been vaccinated. Okay, so it's been how many weeks? And she's fine. And that's the greatest level of evidence. That's the evidence that people are looking for. And I think sometimes what we're doing is we're using too much science when people don't really understand it. So I think we need to show what is really happening. And sometimes the strongest message is when you can say that the uptake of vaccines in the hub, in this particular hub, is 80 to 90%. That's a very strong message. Yeah, and that really shows that people do feel it's safe, rather than give the message which is contrary to that people don't feel it's safe, and we need to work on that. And I think sometimes the messages that are going out there, they can give the wrong understanding, and some individuals thrive on those kind of messages. I'll finish on that note anyway.
Well, that's lovely. All very useful, and unless anyone's got anything else that they wish to add, we'll bring the meeting to a close there. Thank you so much to all the panel members who have taken the time out, and everyone who's contributed, and most especially Shmaila and Sue, who joined the panel just in the last, I guess, 24 hours. But it's been really useful. And the next meeting, as I said, will be 10th of Feb, which is a Wednesday. We had planned these 3 consecutive meetings, and then myself and Hummer and Matt will have a chat to see if there's any benefit in continuing it on a fortnightly basis, or whether we might move it to maybe a monthly basis, dependent upon what the demand is. But yeah, I hope you guys all have a great end to the day and the week, and we'll speak again soon. Thank you. Cheers, Matt.